In the last section, we talked about microorganisms, actually in the last two sections, because they're all those wonderful microorganisms to talk about. All the little creepy crawlies that could potentially make us sick. So, a microorganism in and of itself is not going to make you sick. What happens is a lot of these organisms, microorganisms, are what are called opportunistic pathogens. In other words, if they're in their normal place where they're supposed to be, and bacteria do a lot for us in the world and in our bodies, and if they're in their normal place where they're supposed to be, they're just hanging out, doing their thing, and that's a good thing. If they get where they're not supposed to be, so some of our resident flora, they're helpful in preventing other organisms from establishing a colony. So they take up space and in our body to basically plug the holes to make it so other organisms can't get in. There's just no room. So sometimes when you have to go on antibiotics for whatever reason, maybe you're having dental surgery, I don't know, but you have to go on antibiotics for some reason. It's a good idea after you're done with that antibiotic regimen to, and we'll talk about antibiotic resistance, it's a big thing, but it's a good idea to then take probiotics to rebuild your normal flora. So it's an important thing. So when you're using antibacterial drugs to treat infection someplace in the body, it's also going to destroy part of your normal flora, and it allows for an imbalance in growth, and so you could be invaded by opportunistic pathogens that are like, yay, there's room for us, we're coming in, and then you get sick. So this lecture could actually be subtitled Stuff That Can Kill You, because infections are what's going to take you down. So an infection occurs when a microbe or a parasite is able to reproduce in or on the body's tissues. So infectious diseases, they may occur sporadically in individuals and localized groups, or they can be worldwide pandemics or regional epidemics. So we're just going to, of course, define some terms, because we always do. An infection is when the organism is able to produce in or on our body's tissues. We're infected with that organism. A single individual is a sporadic outbreak. Continuous transmission within a population, like during the officially declared flu season, that sort of thing, can be endemic, meaning the flu's just hanging out, waiting for its chance. We haven't eradicated the flu. It is within our population, and it's going to stay there until something else happens. Something changes the environment. An epidemic is a higher than normal transmission or spread to a new geographical area. So that's more like the officially declared flu season. It's higher than normal transmission. There are those times when you get a cold or a flu not during the cold or flu season, which totally stinks, but there you go. So that would be considered a sporadic infection. Epidemic, higher than normal, and pandemic it's all over the world. And in this day of international travel and whatnot, that could happen. Okay, so knowing the mode of transmissions of microorganisms and methods of control is essential to prevent and control infection within the community. And as healthcare professionals, that is really important. You're thinking, oh, I'm going to work in physical therapy. I don't care about infectious agents. Yes, you do. So it's really important. There is a chain of events, which is depicted here, that occurs during transmission of infecting organisms from one person or organism to another. So there has to be, first of all, a reservoir, which is a source of infection. It could be a person with an active infection or a person who's asymptomatic, but they're harboring the microorganisms in some form or another. So the person who is subclinical may be in the early incubation stage of an infection, or the person might be the carrier of an organism and never develop the infection. So just because someone's asymptomatic doesn't mean they are not going to transmit infection. And that is the very basis of what you have learned about in 110 and what we're going to continue harping on in this lecture is standard precautions. So this part of the lecture we're going to talk about infection, and the next part we're going to talk about treating infections. So standard precautions are really important because people who are asymptomatic can still transmit disease. Okay? A carrier is that person who is asymptomatic and they're still transmitting the disease. So in the book, they give the example of hepatitis B as an infection that's often transmitted by unknown carriers or persons who have a subclinical form of the infection. So the reservoir also could be an environmental source such as contaminated soil, or an infected animal, water, soil, food, or equipment. So that reservoir could be anything. It's just wherever that organism is stored, and then there has to be a path for it to get to you. We're going to talk about that. So the mode of transmission from the reservoir to the new host can be a lot of different ways. So there has to be a portal of exit from the reservoir whereby the agent leaves the reservoir. So it can be, if it's airborne or waterborne or foodborne, or by direct contact, that's how it gets transmitted to the next person. That the mode of transmission is the method where the agent gets to a new susceptible host. So direct contact, I think that's pretty obvious what that means. You touch someone. You can be touching body fluids or an infected lesion, or sexual contact. That's another direct contact thing. Microbes might be in the blood or body secretions, or a lesion on the body. And some microbes can be passed from the mother to the fetus, but not all of them. Some of them don't cross the placental barrier. Some of them don't cross the blood-brain barrier. So there are baddies out there that do, though. You can also transmit by indirect contact. An indirect contact is the intermediary, like a contaminated food, or the person with contaminated hands washes their hands, dries them off on a towel, sets the towel down, the next person comes along, picks up the towel, and wipes their face with it. That's indirect contact. And the inanimate object, such as linen or a towel or bed linen or something that carries the organism, is called a fomite, F-O-M-I-T-E. So that's our indirect contact. Or like the latest thing in the news is that romaine lettuce, it's transmitting, it's contaminated by human fecal E. coli in the water, and it becomes the mode of transmission. It's an indirect contact transmission. Droplet transmission can be oral or respiratory. This guy here is doing it. You sneeze, those droplets go out, and somebody else inhales them. So during the cold or flu season, stay 3 feet away from everybody at all times. Obviously not possible, but do your best and sneeze into your elbow or cover your sneeze so you don't become a mode of transmission. Aerosol transmission involves small particles from the respiratory tract that remain suspended in the air or travel on air currents. And those actually hang out in the air longer than droplets do. So there's special isolation techniques for those in a hospital setting. Vector-borne is where an insect or animal serves as an intermediary host, like malaria. The mosquito is harboring the microorganism and they transmit it to you by sucking your blood. So really one of the major things that you can do right now, every day in your life to break the chain of infection is to wash your hands. Do it often, do it thoroughly. So once you have the mode of transmission, you have the portal of entry, and so it can be anything. If you have a susceptible host, and your susceptibility is going to depend on someone's health status, their immunity, their age, their nutrition. If any of those is compromised, they're going to be more susceptible to infectious agents. So one of the things that you can do to break the chain of infection, so you can break it at any point. Get rid of reservoirs. Not always possible to get rid of all of them, but you could stop it at the portal of exit, meaning you're going to sneeze into a Kleenex instead of your hand. You can stop them, you can avoid direct contact and food, air, and water contamination. Kind of complicated. You can make sure your portals of entry are not available to microorganisms. So a portal of entry can be your respiratory system. It can be a cut, a break in the barrier to the outside world. By not being a susceptible host, you can stop the transmission of infectious agents. So make sure you have good nutrition, good sleep, keep up on your health status, age. There's nothing you can do about that. But you can reduce your exposure as a susceptible host. So this is the diagram from the book that has all sorts of transmission portals of infectious agents. So frequent proper hand washing is essential in infection control and has been shown to be the most commonly ignored procedure in maintaining personal and public health. Isn't that interesting? So in the hospital where I work, they encourage the patients to ask employees if they washed their hands. So you can't take it askance when somebody says, hey, have you washed your hands recently? And I always say, because I'm a crazy hand washer, I go, yeah, I just washed them. Let's do it again just for fun. Or let's gel just for fun. So you can never wash or gel enough. Wash your hands. Do it right now. Stop the recording and go wash your hands. So direct contact, there's no intermediary, person to person. Indirect involves an intermediate object or organism. Droplet, drops in the air. Aerosol, small particles from the respiratory tract suspended in the air. And those guys travel farther than droplets. Vector-borne is the old mosquito or another animal that's the intermediate host. Nosocomial infections occur in healthcare facilities, hospitals, nursing homes, doctor's offices, dental offices. 10 to 15% of patients acquire an infection in the hospital because, well, it's 10 to 15% of patients that are in the hospital acquire an infection because there are lots of microbes to choose from. Yay! There are patients with undiagnosed infectious disease, so there's our reservoir right there. That's a shared environment. There are other sick people there. The course of treatment might cause weakened immune system. And a lot of healthcare workers and fomites act as reservoirs. So as healthcare workers, if we don't wash our hands and deal with our linen and soiled things in an infection control aware manner, we could be the source of nosocomial infections. So these guys are upset with the guy in the lab, and they want to become pathogenic. So they're opportunistic pathogens. So there is a table in the book where they talk about the CDC. This is 2011 data. The CDC identified most frequently occurring nosocomial infections in U.S. acute care facilities. Pneumonia, and it has the estimated number of cases, which I'm not going to read to you. You can read them yourself. Pneumonia, gastrointestinal, urinary tract, bloodstream, post-surgical, and other. And every one of those things can kill you. Not a good thing. So, host resistance. A normally healthy individual is pretty resistant to infection. You can eat stuff and you can be exposed to stuff, and your defenses are going to protect you. But with some infections, like tuberculosis is a good example, and we'll talk way more about tuberculosis. Host resistance is a primary factor in determining the risk of active infection following exposure. So this is the box from the chapter that talks about resistance. So the intact skin and mucous membranes, that's one of our non-specific barriers, remember? Our body secretions, stomach acid and tears have lysozyme in them, and they fight those bacteria. Non-specific phagocytosis are little guys just going around cleaning stuff up. An effective inflammatory response, we talked about in the previous chapter. Absence of disease, like you don't have anything else that's demanding your resources. And an effective immune system, meaning you're producing all the things you need to do to take care of yourself. So unfortunately, the microbes out there who really evolved in concert with us, they have developed things to make them more virulent to meet up with our resistances. So they have more exotoxins and endotoxins. They produce more destructive enzymes that are going to get past our body secretions. The spore formation protects them from nonspecific phagocytosis. And if you just get a lot of them, they can overwhelm your defenses. And the presence of the bacterial defenses, kind of their resistance, bacterial capsule and bacterial pili, can increase their virulence. The pili help them stick to stuff. So, the things that can reduce your resistance: age. Babies and old people, they are more susceptible to infection. Babies, because their immune system hasn't developed yet. Older people, because their immune system is not functioning as well as it did when they were younger. Pregnancy, you're more vulnerable because you're building a new human being. Your system is busy. Genetic susceptibility. Some people are just more susceptible to certain microorganisms. Immunodeficiency. Your defenses are down. You can't deal with it. Malnutrition. It's another factor in your defenses being down. Chronic disease. Your immune system is busy dealing with other things and doesn't have time to deal with bacteria. Severe physical or emotional stress can decrease your resistance. Inflammation or trauma can decrease your resistance. So you're in a car accident and you go to the hospital because you were in a car accident, and now you're more susceptible to nosocomial infections. Impaired inflammatory responses, because that is one of our non-specific defenses. Pathogenicity is the ability of a microbe to cause disease. So this guy looks pretty pathogenic. Virulence is the degree of pathogenicity. So how invasive is that guy? Does it have enzymes to break through your cell walls? Is it very mobile? What kind of toxins does it make? It's exotoxins and endotoxins. Does it have those pili and fimbriae to adhere to tissue and specific receptor sites? And how sneaky is it? Can it avoid your defenses? So all of those things determine how virulent something is. So there's all sorts of scary stuff going on in the world of infection. There are newly emerging diseases that are antigenically different forms of common infections, such as influenza. So it's a new form of the flu that your body hasn't seen yet, and you don't have any tools to fight it yet. When diseases spread beyond normal endemic areas, the people in the new areas don't have the immune system tools to fight. Superinfections. This is a scary, scary thing. Multi-drug resistant forms of existing diseases such as TB and Staphylococcus aureus. They keep on acquiring new resistance to antibiotic drugs, and they're harder and harder to fight. It's terrible. So MRSA, which is methicillin-resistant Staphylococcus aureus, is about 25% of people in the community, well, in this area anyway, have methicillin-resistant Staphylococcus aureus as part of their normal flora. So it's an opportunistic pathogen. If it gets somewhere in your body where it's not supposed to be, it can wreak havoc, and the drugs don't work against it. So it's a huge issue. Antibiotic resistance is a big issue. One of our assignments this week is talking about antibiotic resistance. There's a pretty scary little video about TB in the Russian prison system. And you think, oh, big deal, that's way over there on the other side of the world. Yeah, it can get us. So watch that and think about it. And there are things that you can do to avoid antibiotic resistance, or to help stem it. We're down that path. It's we've gone there, but there are things that you can do to minimize the damage, hopefully. So infection control requires two approaches. I talked about this a little bit earlier: standard precautions and specific precautions. So standard precautions are used in all settings with all clients when body fluids may be exchanged. And we're talking every body fluid. Saliva, sweat, blood. And if you think you work in a setting where you don't need to use standard precautions, you are fooling yourself. You need to use standard precautions when you ride the bus. You need to use standard precautions when you're at the grocery store. So basically it means treat everything as if it were infectious, because it probably is. So if somebody is driving their little grocery cart and they sneeze on the handle, and then they park that cart and go and head out of the store, and then you walk in unknowingly, grab their cart, that grocery cart could be a fomite. You're exchanging body fluids with that person because they just sneezed on the handle. So you might feel weird like sterilizing your cart, but do it. And we'll talk about disinfection and whatnot in the next section. Specific precautions are for clients diagnosed with a particular infection. And these are used in addition to standard precautions. So just assume that you've got standard precautions going. In other words, wash your hands and isolate yourself from fluids. That's standard precautions in a nutshell. Specific precautions might be you need respiratory precautions, you need certain other ones. If you work in a hospital or other inpatient setting, usually it's pretty clearly marked on the door before you go in what precautions you have to take. So with the infection cycle, what we want to do is we break the chain of infection. So we talked about the chain of infection. Really isolating infected people, it says in the book, and I think this is ever so true, isolation of infected persons is rarely carried out on a large scale. Especially with diseases that you don't have to report to anybody. So someone has a cold, they say, I can't take the day off work, and they go in, there you go. They are not isolated. So all of these things in this chart on breaking the chain, it's all things that you can do to break the infection cycle. So it starts with the reservoir. So with the reservoir, if we reduce the number of exits that it has, so by covering our cough or covering our sneeze, that can break the chain right there. With the exit going to transmission to the new host, if you put up a barrier to the exit, like a Kleenex, seriously, Kleenex is a good infection control thing, you can break the chain right there. With direct contact, you can use your personal protective gear, which you've been learning about in lab this quarter. Gloves, glasses, gown, safe waste disposal. That can break the direct transmission chain. Indirect transmission, you can break it with hand washing, disinfecting and sterilizing things, proper food handling and cooking, and good water treatment. Break the indirect transmission right there. When I used to work in a subacute facility, it was in the day of paper charting. That day is pretty much over, although you'll still run into it a little bit. But I always had my clipboard notebook thing that I had with me, and I had my patient list and everything. And I did not take that into the patient's room because I didn't want to be a vector for infection. So I would look at my plan. I would set my clipboard down at the nurse's station. I would go into the patient's room, work with them, come out. Of course, I washed my hands before I came out, and then I would get my clipboard back and write down my things. So, and if you don't have some place to write, like you're taking vitals or something, you don't have some place to write it on your arm, write it on your leg, write it on a piece of Kleenex. It doesn't matter, just don't take things in and out of the room. So once the microorganism has already entered the body, having current immunizations can break the chain right there. Not being a susceptible host, so health status, etc. Being a carrier, you can break the chain from the carrier with isolation and standard precautions. And infectious disease, you can break the chain between infectious disease and a reservoir with standard precautions as well. So, don't be another link in the chain. Break the link. Wash your hands. Take precautions. Use your personal protective gear. So, it's really super important to pay attention to these things. Every place I've ever worked has had me do education, and the hospital where I work now, we have to do it every year, on infection control. So it's really important stuff to know. So additional techniques for reducing transmission include adequate cleaning of your surrounding and clothing. So don't wear the same scrubs that you wore yesterday. Sterilizing or complete destruction and removal of all microorganisms. That's the definition of sterilization. You can do that by autoclaving, and we'll talk about that next. Disinfectants, antiseptics. Okay, and we'll talk about those individually. So, locate and remove or isolate the reservoir of infection. Identify and restrict access to contaminated food or water. Reduce contact between infected persons and the remainder of the population. In other words, stay home when you're sick. Or wear a mask. That's even a better idea. Block the portals of exit and entry. Wearing a mask can do that too. Removing or blocking modes of transmission. Reducing host susceptibility by immunization, adequate nutrition, and access to health care. Big stuff. Then I was saying too, adequate cleaning of surroundings and clothing. This person is cleaning a hospital bed. Sterilization, disinfectants, and antiseptics. So sterilization of equipment is done by chemicals or heating in an autoclave. So the equipment has to be cleaned prior to sterilization or it will remain contaminated. So you clean it and then you autoclave it. Antiseptics are things that are used on the skin and tissues. Disinfectants are used on surfaces or objects. So the disinfectant things that you wipe down equipment with, that's a disinfectant. The stuff you put on your hands is an antiseptic.